Hello and welcome to the Mental Health Advantage podcast, where HR, benefits, and total rewards leaders explore the future of workplace well-being. I'm your host, Sokoler, founder and CEO of Journey, the leading proactive mental health solution for modern companies. In each episode, we bring you expert insights, real-world strategies, and candid conversations on creating healthier, more productive workplaces. Make sure you subscribe so you never miss an episode. Now let's dive in. Hello, everybody. Today I'm joined by Nicole Stec, Vice President at Lockton and their Wellbeing Consulting Leader. Nicole has spent her career at the intersection of population health, culture, and strategy. She led the national team designing next-generation employee engagement and well-being programs spanning mental health, financial wellness, caregiving, and more. How are you doing today, Nicole?
Doing great, Stephen. Thank you so much.
Exciting to be here with you. So, Nicole, you've worked across many industries, helping companies build integrated well-being strategies. What was one moment, either personal or professional, when you realized that mental health, finance, and caregiving pressures weren't separated issues, but really deeply intertwined?
That's a great question. I think spending almost 20 years in this industry, on the employer side, now on the consulting side, meeting with employers, hearing some of the struggles and the stressors and the challenges that their employees are facing, I always knew, there's an interrelatedness of it and the different dimensions of well-being and how those are being supported. I think with these three areas specifically, I always knew they were intertwined, but I think for myself, probably more personally, just experiencing the interrelatedness of those three probably speaks most to me. I'm blessed to be a mother of four. My husband and I have a full team and a full house. And, just the experience of just becoming a new parent with that first child, there's so much emotion, you think mentally, that goes along with that, from the excitement and the joy to the fears, the anxieties of not knowing. And then once being a parent and having a child, like the stress, the challenges that come with learning this new role and this new human that you have in your life. I think that, speaks to a lot of parents out there, just that initial change with that first child. With that, also having another human to care for financially, it's going to impact you. Maybe there's not as much money going into your savings as you used to have. You're spending, more money on things that you never have before, such as diapers and wipes and formula, you name it. Not to mention getting to the point of, if you are both as partners have careers, you have a child in some form of childcare, whether it's, at a daycare center, a family caregiver caring for them, the expenses that come with that. And it's just this intertanglement of, you have, caregiving, it's wonderful, but it can be costly. It can be exhausting mentally. Financial stress then, also impacts your mental health. And then you think about, if your mental health is being impacted, how that's impacting how you're showing up as a caregiver. I mean, everything is very much interrelated. And I can say I've, experienced it personally. And I think in the workforce, working with our clients, we see this frequently. And that's how we, really want to help them design a holistic strategy to support all of well-being.
Yeah, it's interesting as from a human standpoint, just the idea of like intellectually, we may know something, but then once you experience it, it's a totally different thing. Like I had kids later in life. So I'm 46. My son is 22 months old. So, I had 40 plus years of knowing that having a kid was a big thing. And probably the last 10 years, most of my friends have already had kids. But knowing that and living it are two very different things, right? I mean, especially in your case with, a whole handful, or one short of a handful, I guess, yeah. It's really interesting. And then what do we do when we're running our own teams and then also obviously advising other teams? Quick question before we hop in. How did you get into this line of work?
That's a good question. I've always had a passion for health and wellness. My undergrad degree was in kinesiology, exercise physiology, so always passionate about just health in general. But, after college, I didn't want to go the pre-PT, I didn't want to go physical therapy route. I didn't want to go medicine route. I really just wanted to talk about health and like how it's important. And so I really first became a health educator, a wellness coordinator for a military installation. So worked predominantly with service members and their families and retirees in helping support their education and awareness on different topics. From there, I began to work for a few different healthcare systems and working internally with developing their workplace wellness programs across a number of, again, different dimensions, thinking about at Lockton, how we support is like the dimensions of career, community, financial, and self. And so typically a lot of these strategies that I've done with employers have followed a similar format. And then just continue to work in the workplace wellness industry on the employer side for 15 plus years. And in the last 2.5 years, I've been with Lockton. Really a great opportunity to consult and share some of my experiences and learnings, but also work with a very diverse book of business of clients when it comes to industry size, and really help them tackle some of the most, impactful, challenges that they have to date when it comes to really supporting their employees and the overall employee experience.
Yeah. Yeah, I love that. We're talking specifically here about mental health, financial well-being, family stress. Why do you think organizations have historically siloed those when it comes to benefits and support?
I think depending on the subject area, I think benefits teams, maybe they get anecdotal feedback from leaders or employees in the organization that they're, hearing issues around maybe childcare, or maybe it's looking specifically when they look at the health claims data, with their broker or consultant, they see behavioral health has, there's a high incidence, and they're seeing things separated and from different perspectives. And so, they see the issue, they want to tackle it, which is amazing. They want to find a way to help solve the problems that are impacting their workforce. And they're not necessarily taking the time to take a step back and look at the bigger macro picture of who their workforce is and what other influences are impacting those health behaviors and those decisions. And so, at Lockton, what we do with our clients is it's really important for us to help them take that step back, assess not only their health claims data, but also look at an inventory of what programs and policies they have in place today. And then what are they getting from their employee feedback? And how does that really kind of influence what are the next step decisions to address some of these issues that they had brought to the table?
Yeah. And what do you think are the risks, both from a human standpoint and from a business standpoint, of continuing to treat these as separate concerns versus something more integrated?
I think from the business perspective, I think there's obviously a loss of productivity potentially with their workforce if they're not addressing or providing resources to address these key different areas of well-being for their workforce. The risk of turnover. I think I read a stat recently from Harvard Business Review that it was about a third of the workforce was opting to leave their positions after becoming a parent. There's a certain time window where it's it just didn't make sense for them to work just because of the costs of childcare and the burdens and the stresses that come with that. So turnover is certainly another one. I also think of just even the health of their workforce. And when we look at the data when it comes to their chronic conditions, there's a lot of data out there that shows that if you're not addressing the mental and behavioral health aspect of an individual's health, it's also impacting their physical health conditions negatively. And so, looking at some of these key factors as a business, those are crucial. From a human perspective, I think the risk of not addressing these holistically is that the individuals get burnout. They leave the workforce and potentially put themselves under more stress or financial strain, or you name it, any one of those challenges that they might have by leaving the workforce for their family. I think it also impacts their overall career development potentially too. There's those concerns of leaving work and when to come back and how does that look. So I think there's certainly some risks individually that have to be thought of too.
Got it. And as a consulting leader at Lockton, how do you guide employers to build integrated strategies across mental health, financial wellness, and caregiving? And I guess one follow-up question to that is, how's the reception to that? Is that, oh yeah, that makes total sense? Is that, oh, that's different than how we've always done it, or our executives think about it differently? How is that received?
As I had mentioned a little bit earlier, I think, one of the first steps is when we talk to our clients about well-being, we give them kind of the high-level framework of these different components or pillars, as we call them, of career, community, financial, and self. And what we do with clients is really help them go through an inventory of the benefits, the programs, the policies that they have in place that impact these different dimensions, whether it be time off policies to mental health solution benefits, or maybe it's the retirement plan, really doing an inventory. Also looking at their demographic data for their workforce. Every client has a unique workforce. And so really looking at not only the generational breakdown, the gender breakdown, potentially even the income breakdown in different bands to understand where and how, these elements could be impacting the actual solutions that they have in place today. Maybe they're not maybe you have a really young workforce, and yes, you're offering something in retirement and you're putting all of your efforts and investment for financial wellness into retirement, when really they're stressed about making, living paycheck to paycheck and paying their bills, to also paying off student loans. There could be a number of other stressors that are more financially relevant for a younger workforce than an older workforce. And so again, assessing the population, looking at the health claims data, and then also doing an inventory of what do they have in place today that they could be either communicating or leveraging a little bit differently before saying like we have to do something different. But just kind of bringing that to light is usually very eye-opening with our clients, and gets them thinking in different ways about how to address well-being. So yeah, I think we're also very fortunate that many of our clients, I would say most of our clients, are very passionate about wanting to do something in this space, recognizing how it impacts the overall employee experience.
Yeah. And what key metrics or outcomes should companies be measuring when they take a more holistic approach?
Yeah, I think one of the things I also have mentioned is the importance of employee feedback. And so I think most clients have some level of like an annual employee engagement type survey or some element of that, but there needs to be a question around well-being or overall employee experience to see how that needle gets moved year over year based on some of the tactics or solutions or strategies that the client's putting in place. So having some baseline measure that you can also take to the C-suite to say, like, here's what we're seeing year to year in this measure, or multiple measures that you're tracking. Other pieces that you're going to look at more long-term include, absenteeism and presenteeism, turnover, looking at the health claims data from your broker and consultant, seeing how those also are potentially impacted or changed. And then the participation and utilization in the programs that you put in place, like how are you tracking those? Are you tracking those? I think sometimes the clients have put out benefits before and not necessarily taken the time to evaluate and create baseline measures to see how what they're doing is actually supporting their workforce.
Got it. And can you share an example of a company that's done this well and what the results look like?
Yeah, certainly. One of our clients that we work with fairly regularly, a large healthcare system, we started working with them 5-6 years ago, and they had some elements in place for a well-being strategy, including some elements around caregiving, mental health with an in-house EAP, some other benefits that also resonated with the physical health components, and they really wanted to take it to the next level. And so what we did with them is we conducted focus groups across their organization, taking in feedback from a diverse set of employees from across the different departments and locations. We also did an inventory of, again, all the policies and benefits that they had in place, and then looked at how their policies and programs benchmarked against best in industry, and kind of gave them a little bit of like a report card on these different dimensions of well-being, where they're excelling, where there could be some improvement, and help them devise a 5-year roadmap on addressing their caregivers in the workplace, inclusivity, financial wellness, and driving engagement. And there are multiple tactics that we outlined for them to address, over the next 3 to 5 years. And what we've seen, some of the key success metrics we've had with them, they evolved their mental health support from being an in-house EAP that had dismal utilization and reviews to moving to a more comprehensive EAP with education, more sessions per issues per year, to ultimately moving to a very enhanced mental health solution that is driving access to care within 24 hours. There's digital components, but that all happened because each step provided really increased engagement and access for their employees to want to support their mental health. There was also a strong communication strategy behind that as well to drive awareness and employee engagement in what they have made available. And then another aspect of that program, just kind of in the topics we're talking about today, caregiving was a huge focus for a healthcare system, knowing that they are predominantly female workforce, childbearing age, thinking about how are they supporting caregiving. They'd always had a caregiving provider for a discounted network, preferred enrollment, those options, but they enhanced their backup care days and time that their employees could use per year. And year over year, the last 3 years, they've seen a 30% increase year over year in the usage of the backup care. And so that's keeping their employees at work. It's ensuring that their children or their elder parents have a place of care or somebody caring for them in a quality way. And ultimately, really keeping their employees at their organization. They're being an employer of choice in the area. And so a lot of good successes come from that engagement, and it's been several years in the making.
Thanks for listening to the first half of the episode. I hope you're walking away with some valuable insights. I want to take a quick pause to tell you about my book, The Mental Health Advantage. If you found this conversation useful, you'll find 300 more pages packed with strategies, insights, and real-world applications. Grab your copy on Amazon. Just check the show notes for the link. And if you're looking for a more comprehensive mental health solution for your company, let's chat. You'll find another link in the show notes to reach out and explore how Journey can help you. Now back to the show. Let's talk about caregiving. So it's one of those sort of invisible burdens, right? I think it's one of those things where people are so often not aware of it, even with the sandwich generation. It's just unspoken about oftentimes, and is similar to what I had shared earlier about experientially, people not understanding it. It's just one of those things that does just go sort of unnoticed and unspoken about. So let's talk about that. How are you seeing this surface in employee engagement or performance?
I think some of the key areas that we see or hear from clients, there's levels of burnout. We're thinking about the absenteeism and presenteeism at work. If you're a caregiver and you have responsibilities and you have to make phone calls and rearrange your schedule, like many a times that might have to be done during work hours because of just the times that you're able to reach doctor's offices or caregiving hours. You think about the time being spent at work and the loss of productivity that's occurring. As I mentioned earlier, turnover, caregivers in the workplace having to potentially leave the workforce just because of the cost burden and the time burden in taking care of loved ones. And how does that actually align with their career? So I think that those are some key things that come to play, and then when it comes to employers really addressing those caregiving challenges that exist, there's a few different ways that they can go about doing it. One is first to really taking an inventory of your policies. Like, what are you doing to help support at an environmental, organizational level, support caregivers in the workplace? Whether it's, employee independent healthcare, is it caregiver and parental leave? Is it paid time off strategies? Is it flexible or remote work? Thinking through how these policies are impacting or becoming more relevant to your workforce based on the caregiver population that exists within your workforce is crucial. The next step is to really think about the financial assistance that caregivers might need. And there's ways that employers can help support caregivers financially. Dependent care, flexible spending accounts. We think about potentially even stipends or subsidized care forms with caregiving providers. There's lifestyle spending accounts. There's so many ways that we're seeing employers get really creative with how do they support caregivers in the workplace financially. And then lastly, it's more of, thinking about there's so many solutions that have really kind of come onto the scene in this space in the last 5 to 10 years. It's far more than just having, daycare centers available, providing seats for kids. It's elder care needs. It's care concierge, where there's solutions out there where an employee can call and the concierge will help them find the many different elements of care that they need for a loved one. And I mean, that in itself saves so much time for the individual when you think about how long it takes to find a specialist when it comes to a medical provider, or finding transportation to take, somebody from this appointment to this practice, whatever it may be, the time saving piece there. And then also, for the select few clients that have the space and have the on-site workforce, also, on-site child care centers. That's something else that we have helped our clients work through kind of that process, and potentially on the implementation side of it too, if they have the means and the budget and the need to do something like that. So there's so many ways that employers can support caregivers in the workplace. It's not just a one and done.
How would you think about this becoming part of the culture as opposed to just a random perk or benefit?
Yeah. In making, caregiving more about the culture versus a random benefit, I think it starts from the top. And it starts also with, having senior leadership and middle management buy-in into this is a part of your culture. 3/4 of the workforce has some level of caregiving responsibility, whether it's for a child, a parent, another dependent, a pet. Caregiving is rampant within our American workforce when we look at it today. And really making it a part of the culture, I think, as managers, understanding who your people are. It's going back to what we've talked about around mental health in the past of, having that leadership, check in with your employees and like, how are you doing? What's going on? Like, how can we help you? It's really knowing who your employees are and being able to have like those open and honest conversations and recognizing you might have, multiple employees have different caregiving needs that they're supporting. And that helps to drive at building that culture, is like having that understanding and then also raising that awareness with leadership of like, what are we doing to support them, or how can we better support them with what we have in place today? And so I think it's organizationally, there's got to be a collaborative approach, but then it gets down to those one-on-one relationships, and leaders can have a significant impact in that.
Yep, absolutely. So speaking of leaders, you collaborate in your role with C-suite leaders, with managers, with frontline teams. What's your approach to aligning different stakeholders behind a shared vision of well-being?
I think first it's ask questions, seek to learn from them. What are some of their most pressing challenges, and how does that relate to developing employee and workforce well-being within their organization? Usually there's some level of an opportunity for a tie-in there. Normally we hear from, the CFOs want to cut costs, and how can we cut costs to be able to manage, what we're doing for our organization. And I think when you talk about well-being, there's so many levers that can be pulled to drive at better health outcomes, reducing healthcare costs. But then there's also levers such as caregiving, where if you have a lot of absenteeism or your staff shortages, how can you provide some level of a caregiving benefit to make it easier for your workers to be at work, come to work, be present at work? And so it's really just trying to understand from those different key stakeholders, what are their main objectives, and how do you tie that to the bigger impact of what well-being can do for the organization?
And when it comes to employers who are just getting started on this, you obviously work with, a variety of folks, right? Some who are really far along in their journey and others who are just getting started. What's a piece of advice you'd give folks who are on the earlier side of working towards a more integrated well-being strategy?
I think it's simply know your data. And I've talked about the different pieces there of, doing just a basic inventory of what do you have in place today within your benefits? How are there certain elements of those benefits or those solutions that you have that you haven't maybe communicated, haven't leveraged, haven't learned enough about, but really trying to take a deep dive look at those, but then also what other teams or practices exist within your organization outside of the HR benefits bubble. One client we worked with, they discovered, a few years in after, kind of talking through their strategy, that they had a resilience champions team that they didn't even know existed. It wasn't a part of their official employee resource groups, and but it had developed kind of as from a groundswell of just employees being interested in it and helping to support each other. And it's well, what an opportunity to leverage that group to help communicate all these offerings that you've been able to support your employees with. So it's, doing a deep inventory of what you currently have in place today. Look at your workforce demographics, understand who you're speaking to, what your audience is, what are their key needs, and looking at how do those benefits actually address some of those key needs based on age, gender, income, and then again, their health data too, to really kind of look at how do you move the lever on some of those other chronic conditions that are impacting their overall well-being.
I love that. Let's stay on the leader track. What's one sort of misunderstanding or misconception or myth about employee well-being that you wish leaders would just let go of?
It's amazing. I've been in this industry for close to 20 years, and I've been on the employer side a lot, being on the consulting side. I think when I'm speaking to leaders that are maybe newer to the space, they still think that well-being is more of this fluffy perk or something that's like an extra, but it's not as integrative to their strategy as a business as it should be. And so really kind of explaining and sharing with them how employee well-being impacts the bottom line, and it should be a strategic imperative, is something that we continue to get across with different clients. And that's something that I think I still find surprising today, 20 years in.
What gives you hope about how organizations are evolving their approach to supporting people?
I think to the point of just even what I shared in that last response of where I do feel like generationally, things are changing within the workforce. We're seeing just, Gen Z come bursting onto the scene of just when we think about the ages in the workforce, boomers, leaving the workforce in the next really 5 to 7 years, essentially. And I think there's just different perspectives on what matters most to employees. And it comes from senior leadership. I think they are also exhibiting and experiencing some of these same pain points that their employees are, whether it's around financial stress to caregiving to mental health. And I think that deep understanding of just how it personally impacts you as a leader helps to create a better opportunity for your employees and bringing that perspective to the conversation to address well-being holistically.
Absolutely. And if you could design one benefit that every company should offer, aside from Journey Proactive EP, of course, what would it be and why?
I think anything having to do with time. I think, we all can agree that we wish we had more time, like whether it's time with our friends, time with our family, time, to work on hobbies. I think everybody wants more time. And so any benefit that can help to enhance our time away from just life's responsibilities, including working, I think are valuable benefits to add. And this isn't just in the form of time off policies and leaves and sabbaticals. It's also implementing solutions or strategies that really save time for employees, such as, being able to access a mental health provider within 1 to 2 days versus calling all kinds of providers, working through it for days and weeks to be able to get the care that you need. I think anything that can save time is what can make the most meaningful impact to employees, and I would recommend.
I love that. All right. Any final thoughts before we wrap up? Anything you want to share with the audience?
I just continue to think about well-being very holistically. These 3 subject areas that we've talked about today, caregiving, financial wellness, and mental health, are all interrelated. It's a cycle. It's not in just one direction. It's multiple directions. But thinking about how taking what you have within your current benefits ecosystem and really enhancing it or leveraging it and communicating it to your staff, your employees, is going to be important to driving better outcomes.
I love that. That seems like a great place to end. So thanks so much, Nicole. For everybody out there listening, we touched on why mental health, family responsibility, and financial stress must be addressed together versus separately, how to design employee support that's integrated, not siloed, the role of data, leadership buy-in, and empathy in well-being, practical strategies to support caregivers, addressing financial anxiety, and building resilient cultures, and why holistic well-being is no longer optional, it's foundational. Nicole, thank you so much for your time today. It was really great chatting with you, as always.
Thank you so much. It was my pleasure.
Thanks for spending this time with us. We know you're busy. If you enjoyed today's conversation, be sure to subscribe to the Mental Health Advantage and leave a review. Thanks so much and have a beautiful day.